So I actually started off UNSW 2007. I entered UNSW. This is my old uni, but it wasn't this fresh. 6 years as a med student, I was interested in ONG initially, and then I went down the pediatric routes. And ophthalmology sort of came up briefly, but then I said to myself, this is too hard. Like, I won't get on. I'm just gonna like file that away, no thanks. Even though like I was myopic, I was like -4, I was interested in laser eye surgery, getting it myself, but I was too scared. And I loved eyes, but then I wanted to just, when you feel that you can't do something. So I said to myself, oh, don't bother, I'm just not gonna get on, just focus on something else. So I actually completed in 2012 and went to Concord Hospital, got allocated to Concord. Again, I was still I wanted to do pediatrics at that point. So I was like, I think pediatrics is for me. And then I'd like lined up all these peds terms at Concord. And then I somehow, they were like getting me to tick boxes on like, what term do you want to do for surgery? And I was like, initially I was like, I hate surgery. So I was like, let me just put ophthalmology because it's the least surgical out of all these surgeries. But I still got orthopedics. I had to hold a few legs and they kept dipping under my like not so strong arms. So they kicked me out of theatre. So I happily managed a ward and no one died. And this ophthalmology term appeared at the end of the year, term 5. And I remember thinking, oh, whatever, like, it's Christmas, just do it. But I did it and I loved it. I loved the slit lamp. I loved how everything's magnified times 40. I got to see some really interesting internal structures in the eye. I examined the retina, which is something I didn't realize, it's quite hard, but, I learned how to examine the retina. And I also started doing research. So prior to that, I'd published no papers because I hadn't really figured out my life. So the good news is in med school, if you do nothing, it's still fine. You don't have to feel stressed because I was PGY. So I was at the end of internship, in one term, I think I wrote 3 papers because I just was interested. It was interesting. I did a case report, like a retrospective study, and I also did another case report. So all up, I think around 3 papers in one term. And I was like, I think I want to do ophthalmology, but it's too hard. So I was like halfway through a pediatric master's that year. So I decided to just complete it. I was like, there's no point switching to the ophthalmic science, even though I do recommend ophthalmic science masters just for the exams. Like when you do get onto ophthalmology, it would have already covered so many basic, modules. But I finished that, and then I did some more research, kept doing research, and then I applied for the Sydney Eye SRMO job, PGY3, and just did that job. Once that job is like very all about eyes, like everyone there wants to do ophthalmology. So then you end up with a bunch of people who all want to do the same thing and it's super competitive, there's no spots. It's quite stressful that year. And then because there's often like a backlog, you got to wait. So I did a registrar year. I just did a general pediatric registrar year the following year just to have a job of some sort and to continue doing my research on the side, and then I got on the following year. So I feel that, I was really lucky I didn't have to wait 8 years, but not that that's very common, but some people I know, they're so dedicated, if you wait long enough, you will get on. That's my opinion, unless there's an issue. Issues are like severe issues like patient problems, like management issues or like attitude problems. Overall, if you're a nice person, you work hard, you will get there. And then I did ophthalmology training for 5 years. And then I was like, I plan on being I am a pediatric ophthalmologist. So I see kids all the time, and as well as adult patients as well. But during my fellowship in pediatric ophthalmology, I started developing an interest in myopia management. So to me, myopia is like an epidemic. Almost 50% of the population is short-sighted, and it's projected to get worse and worse with time. So I was thinking, why is it just all optometry that's managing this? As an ophthalmologist, myopia gives you cataracts, retinal detachments, myopic maculopathy, like all sorts of problems in your eyes. If this is becoming an epidemic, everyone's going to get it. It's going to be a huge source of everyone's eye problems in the future. So I said to myself, and then I was myopic, so I was -4 in both eyes. And obviously my discs are tilted, my eye's a bit longer than normal. So then I said, okay, it's time for me to really delve into this. There's starting to be like treatments in myopia management, so low-dose atropine started coming out, and then recently it's like red light therapy, and a whole bunch of like different types of lenses kids can wear to slow down their myopia progression. So I started trialing this on myself as a registrar. So I was like, this is just when the first papers came out. I was still progressing in my early 30s, so my number was still going up a bit each. And I was like stressful, you know, like changing my glasses at that age. I'm like, shouldn't this be over by now? Anyway, so at that point, I was like trialing a few therapies on myself, and I actually found that using that stopped my progression. So I personally think, and my progression was stopped because I started looking at the literature, trialed some of these topical therapies on myself back when no one was using them. And I felt that it stopped my myopia, so I stopped progressing. Then I was like, okay, I'm almost finished with training. I've got my fellowship now, you know, doing pediatrics. And then I started doing pediatric ophthalmology. My myopia clinic started getting more and more busy. Patients, like, they found that I can control all of them, and, you know, they're very dedicated. They keep coming back because they just want their kids to be stable. And so starting to get more and more of a following in this myopia field. And then I said to myself, they kept asking me, oh, laser eye surgery, you know, like I feel like, you know, I want laser eye surgery, my child wants laser eye surgery. And then I started thinking, okay, it's time for me to actually retrain and get my surgical skills up in that sector, because I feel like it's a continuum. You got to control the myopia, and then you should be their laser surgeon. And then I started researching this, and then I was looking at the literature about SMILE versus LASIK. And so I feel like the number one center in the world really is China in terms of myopia. Like, most of the population is myopic, the highest volume of laser eye surgery in China. So then I started contacting different hospitals, different groups about training programs, because in my head I was like, you know, there's that many million people, there must be a training program for laser eye surgery. It must be somewhere, even though it's not advertised. So I did my delving into this, and then I figured it out. It was in Shanghai. So it's all in Mandarin though, but I was like, okay, that's fine. A lot of my patients want to chat to me in Mandarin anyway. I may as well improve my Mandarin. I was like, this is like 2-in-1. And then so I went to China. I did a SMILE, so SMILE is the latest technique. It is very surgically challenging to get it perfect. And that's why a lot of surgeons call themselves LASIK surgeons, because that's lifting a flap. It's a lot more easy technically. But when it comes to actually being a proper laser surgeon, I feel like you have to know how to do SMILE. And so I rigorously did that in China in Mandarin. So these are all, so it was a very interesting experience, but I managed to complete it. And then I came back, and I was just like, okay, so I've now got these excellent skills. What am I going to do? I have no patience. So then I was like, okay, let me just try film a few videos and just see. And then it's like, that's pretty much where I've ended up. This is how this whole journey's landed me here. But I wasn't expecting anyone to be interested in these videos, because I thought they were just like a bit of fun really on the side. I actually have no time to script or think about topics. So it's often, I've got to thank Sydney traffic for being so congested, because a lot of the time it's like literally sitting there with nothing to do. And then in my head, I think about what's happened today. So everything that I've talked about has occurred. So everything is honest, it's occurred during the day. I think about the patients, I think about what's happened and treatments, and then I talk about it sometimes. So a lot of it is, and then people online ask me questions, and I think instead of direct answering them, I may as well do a video so everyone can listen to it. So that's me and my shaky social media videos. So a lot of the time it's like, I'm walking in. I had this whole string over Christmas, I had a whole string of emergency surgeries. Like, it was just like penetrating eye after penetrating eye. And I was like, this is so tiring, but I may as well just like tell people that I'm doing this over Christmas. And they were pretty hot videos. Everyone was interested in seeing me have a hard life. So everyone's like having a good Christmas, and I'm just like doing emergency surgery at midnight to 2 a.m. But they were all it's all been a very interesting experience. I've met lovely people along the way, like Suj. Like, you know, Suj has come to my clinics. And then I've realized, so just a backstory, Mason. So Mason Burns was someone I mentored. We met each other when I was a fellow at Children's Hospital Westmead in pediatric ophthalmology. And he was a med student. He had no idea what he wanted to do with his life. He was just like, I don't know. And I said, give me 4 weeks, check out what we're doing. Just see if you like ophthalmology. And then within those 4 weeks, from start to finish, he decided, I want to do ophthalmology. We published like 2 or 3 papers together. Not that term, because it was only 4 weeks, but from that moment, we then collaborated and did some. And then over the years, because like he's been interested, I've sort of just always been able to, like, he contacts me about stuff, and I just sort of tell him, this is what you should do. yeah, off the cuff. And then he's sort of been very hardworking, so he sort of did the right things and then got on really fast. And that video was really random, Suj. Suj can attest to this. We were not scripted, we just stood there after the conference finished and thought we'd just have a quick chat. And so that's pretty much, you remember, right? Suj filmed it. So that's pretty much my story. I'm really happy, like now that I get to do things I'm passionate about. I think at the end, you just want to do a specialty and work that you enjoy doing. So I enjoy my myopia clinics, I enjoy patients coming to see me and controlling them and the parents happy, child is happy. I enjoy laser eye surgery, like my smile patients. I try, like people are more informed nowadays so that they realized, they should research their laser before they get laser. So more and more people are now realizing smile is the way to go. It's only a 2mm incision. LASIK is a huge flap, a lot less dry eye, much better structurally for the eye. And so that's, so I've got like more and more smile patients are coming through as well, which is, good. So then I'm sort of like hoping that over time, just focus on that. But obviously I do other things. I do a lot of cataract surgery as well. So cataract, laser, and pediatric myopia are my main interests. And so interestingly enough, I can't remember, you mentioned the hospitals. So I work at RPA. So RPA I mainly do cataract. So I do all the cataract lists, cataract clinic, and also pediatric clinic and neonatal ICU ward round. I do Sydney Eye Hospital, I do strabismus there. So anyone with double vision or complex cranial nerve issues, I look after that and fix complex strabismus problems. At Sydney Children's Hospital, which is just here, I do pediatric clinics and pediatric cataracts and general pediatric ophthalmology. So those are the main things I do. And then privately, I've always been at Epping Eye Surgery. So a lot of my clients there are usually just myopia management. If you think about the clientele in an Asian suburb, it's often myopia. Mossman, so at Eagle Eye Surgeons in Mossman, I do all my laser refractive work. So Smile Pro, LASIK, PRK, Presbyond. So Presbyond's actually a laser between 40 and 60 for older people who wear reading glasses. So you can get rid of their reading glasses and fix their myopia at the same time. So I've got a patient coming who's almost -8. He's 51. And I'm going to get rid of his glasses and allow him to read. So he's really pumped, He's like, I've worn glasses my whole life. And so that's Mossman, and an ICL as well. So if you're really high, so if you're above -8, you can have ICL surgery, which is like a small contact lens that's inserted inside your eye in front of your natural lens. And you can be there forever. It can be removed when you have cataract surgery and have standard cataract surgery. So that's a technique that's been around for a while. It hasn't been adopted very much, but it gives excellent outcomes. I learned about it in China, like a lot of Chinese people have had it done, and it's very safe. And then I work at Burwood. Again, it's a lot of myopia work there in cataract. And then I'm about to start at Green Square, so that's like nearby. So it's a cataract and sort of general ophthalmology.
One question.
Yeah.
Thank you so much for sharing your successful journey. That was very inspiring. You started from your medical journey, figuring out your passion, and then finding your passion, working hard towards your passion, then eventually finding your niche within the surgeries that you feel more passionate about. You mentioned throughout your sort of like post-graduation and like years, there was a year that you had to do pediatric.
Yes.
Right?
Yes.
How did you navigate that when you got the sort of a competitive job in Sydney Eye as an SRMO? Yeah. You saw a lot of competition there. Then you realized like maybe you have to do something else and wait and be patient. How did you manage all of those stress and like?
Aria, you've nailed that question. I think about life, and life is never an upwards trajectory. There's always like downward periods and upward periods, downward periods. So that was probably what I call my first period in life. After being a selective high school student, Sydney Girls High School, always did well, got into UNSW Medicine, like a smooth pathway. That was definitely my first year where I was like confused about my life, because I thought I wanted to do this and I thought I was doing well, and then I couldn't get on the first year. So definitely, I would agree, like exactly what you said. When you become a junior doctor, you realize that's when you'll get your obstacles, and getting onto programs, it may not be straight away. You're gonna have to accept there'll be time where you'll be doing jobs that you may not be going towards your future career that you want, or that you may be, knocked back from jobs that you wanna do. yeah, that was a year where I did a lot of yoga. so meditation, yoga, exercise. So I became a bit of a gym junkie that year because I feel like those endorphins helped deal with the stress of not being sure about your life and career. So I feel like that's definitely one of my biggest years in my life where I was like unsure about everything. So I took up hobbies. I continued research and just continued just looking ahead, just thinking, that's okay, I'll just keep trying. And so even if it doesn't work out this year, I'll give it a go next year, I'll give it a go another year. So actually, if you put in your head a timeline that I'm happy to keep going, even if, you know, the next few years don't work out, then, and take up some hobbies, and then you'll be much more, it'll be easier to cope with, what do you call it, disappointments, cope with setbacks, challenges, disappointments, because I don't think anyone really has a smooth journey. Like after I got on, my exams were all fine, like I passed everything in one go. But there are people that, you know, had a smooth way onto ophthalmology that kept failing exams. So I feel like that also is an issue. And then there's also a lot of registrars I now mentor who are in remediation. So like, you know, they look like they're really smooth, but they're like in remediation, and it causes mental health issues as well. So I try my best to sort of help them as well, because I try to give them like the bigger perspective. So like at the end, it doesn't matter if you're in remediation a couple of times, you'll still become an ophthalmologist. You'll still get to do what you want to do and sort of have your own life on the other side. It's just that now you're sort of stuck. But yes, it's true. Everyone goes through that. Like I wouldn't think there's a single doctor who doesn't go through that. And you have to be prepared for it, because normally, like when you're younger, you just do well in school, you get into uni, everything's fine, and then you start dealing with these setbacks when you're a doctor, junior doctor. Yeah.
So it sounds like there is a journey that is written in books, like you become like SRMO and then registrar and consultant, but there are so many other setbacks that are unhidden, but it's part of everyone's journey. Everyone at some point.
Absolutely. I think everyone has. To say that you've had no setbacks would be lying. I think everyone will have experienced something. Yeah.
And you ended up using that as a sort of an advantage, because now you're a pediatric ophthalmologist, so that experience is still required.
Yeah, absolutely. I definitely feel like also just understanding like kids' health disorders is useful. There's nothing in medicine that you can do that's not useful. So if you do something, it'll be useful in some way or other. So I never feel like it's wasted time, even if you, not doing what you want to do as a specialty. If you do something else, it still helps with something else, in your life, absolutely.
And one more question before I open the floor for more questions. How would you recommend for juniors who want to like find a niche, I guess, in this specialty, like explore different pathways, like what are the opportunities out there, nationally or internationally? What are the experiences you reckon?
I think if you want to do ophthalmology, you really need to sort of come to clinic, come to theatres, and just get a feeling if this is kind of what you would envisage yourself doing in your 30s, 40s, 50s, 60s. Like, see if this is something that you would enjoy. I think people who already have an eye condition can already understand that process because they've already seen doctors and eye doctors, and they understand what it entails. But also like just being, it's actually a feeling. I know it sounds really weird, like airy-fairy, but you sort of, the reason you do a specialty, I think, should be based on how you feel about it. Like if you feel like you're passionate and enjoy it, you should do it. If you can't get out of bed and you can't really drag yourself onto that orthopedic ward round, it's definitely not for you, you know what I mean? So I feel like you have to have that feeling, and you generally will have a feeling towards something. I think there's always one specialty that would call out to you, but also like if it doesn't, there's other options too, like side gigs. So I feel like you have to follow that, because if you don't do that, then you'll end up just like doing something that you're not enjoying, and then you'll end up sort of unhappy, I think, overall, long term. Yeah.
And part of it again is that like after all of these years of experience, now you are experienced, but then again, translating that to your sort of patients, another factor that you sort of find another niche to sort of like let them know that there are these services available.
I feel that for junior doctors, I want to be able to support you guys if you want to publish, because I know how to publish. Like in 2 years, I did 16 papers. So I feel like it's important to be able to give back, like during that, like now that, you know, one has already completed it, to help some other people who want to do it get on. Sorry, Siege, yeah.
I had a question about your social media journey. What were the biggest like lessons or life perspectives that you kind of got from it that you look back and think, wow, that actually helped a lot?
Actually, it was, I was really embarrassed to begin with. So I was like, oh, this is so, like, I don't really want anyone watching my videos. So I started on Xiaohongshu, which is a Chinese social media platform because I just assumed none of my colleagues would be on there, so I don't have to be looked. No one will see it. So this is like a safe place to basically talk about things that I want to talk about. And I found it was actually quite popular. And so someone told me, so it wasn't me that decided to go onto TikTok. They were like, oh, you know, the same video that you film for Xiao Hong Su can also go onto TikTok. And I was like, oh yeah, may as well. Like, you know, if I've spent the time to make something, then I may as well put on 2 platforms. So then I put the Xiao Hong Su videos about life as an eye doctor onto TikTok. And then that was actually surprised that people wanted to watch that too. And then on that journey, I've met like young doctors and also like friends, like new friends. Like then I was on TikTok. And then it got to a point where people were starting to talk about these videos and my colleagues had heard about it, and I was just like, okay, well, may as well put the cringe videos now onto Instagram where the action is at. So I was like, so around 4 weeks ago, I just tentatively put a couple up and saw if I got booed or not. And then it was like, not too bad.
Guys, to how you balance everything, because you've mentioned a few things now. You mentioned yoga, you know, exercise, and then you were interested in pediatrics, and then there was a setback, and then you also mentioned, you know, having a life outside of all of that on the other side. So just wondering, as a junior doctor and being very busy, so how do you balance all of that?
I'm being honest, as a junior doctor, I couldn't balance it at all. I would lack in sleep, be sick all the time. Like I'd get sick probably every 16 weeks. I used to mark it on my calendar. I'm like, oh, time for another cold. And then so I remember I was sick all the time. That's where the exercise came, because I was sick of getting sick. So then I decided to, you know, work on exercise and health. But I have a schedule. So I usually, I know I'm going to attend this gym session every morning. I don't go to any other sessions, it's always in the morning. Finish that, then get ready to get to work. And my work sort of aligns to when that's completed. And then I remember as a junior doctor, I was balancing a master's, working hours sometimes between 7 and 11. So you have to do this after hours shift. So your job finishes at 6 and you still have to go on the wards all the way till 11. They were horrendous. I remember thinking, you actually have no life. So there's a couple of years where you have no life, and then you still have no life as a registrar because you're studying for exams. Actually, overall, I feel like, yeah, so you just have no life in general. But then at the end, when you fully finish, you've got your letters, then you can maybe decide which half days you don't want to work and sort of take up. So I think when you're a consultant, people have more hobbies and more interests on the side because they sort of carve out time for those activities. But no, a lot of the time, like as a junior doctor, no life. Yeah, it was like living in the hospital, like on weekends when just call after call after call, so I have to see all these patients. So I just remember, like in Canberra, I didn't leave the hospital. I was eating U-foods the whole time to the point where I vomited like near the end because I had 12 weeks of U-foods. It was so awful. Now I see those ads and I'm just like, oh, I could never, ever, ever getting near that stuff again. Yeah, because I just didn't leave the hospital. I just had it delivered and just lived there the whole time. Yeah. Oh, yeah.
Thank you for your time. Is there anything that you would, although I think your path you said was there's very little regrets. I think many things were rewarding even when they weren't necessarily relevant. But is there anything that you wish you realised or did sooner, even as far back as you might?
Absolutely. I think around 5th year medicine, I had interest in ophthalmology, but I squashed that. So I think at that point I should have just had the feeling and just gone for it. So that's why nowadays when I meet med students like Suj who are interested, I tell them to really go for it. Like the earlier the better. Not to scare anyone who's not started their like career pathway, but just to, if the minute you figure out this is what you want to do, just go for it. Yeah. The more time, the less stressful it is, like when you're working as a junior doctor, because you would have already had like 3 or 4 papers already. So you're not as stressed doing all this data collection whilst working a full-time job, night shifts and after hours. So that's probably what I would do, like just start it a bit earlier. And but you can't change anything. You just do it. Even if halfway through you realize I don't want to do this, it's still worthy of dropping it and doing another specialty that you're more interested in and restarting it again. Because it's still like decades of your life afterwards that you have, dedicated to this work. You may as well choose the right thing and do it.